Once upon a time, I could not walk properly. I had a severe pain on both my legs, left and right. I consulted Dr. Aditya Kapoor. I feel much younger than what my age is. Pain is fairly gone.
Today, I am taking you through the journey of a 78-year-old gentleman who had been suffering with severe knee arthritis. However, he has a very active lifestyle, walks, he tends to swim, and he wanted to be able to squat on the floor. When I saw him, he predominantly had pain on the inside of both knees. He also was diabetic and hypertensive. And at the age of 78, you can understand the concern both with the patient and the family about having his knees replaced. After evaluating him, I found that he is suitable for a partial knee replacement of the inside, the medial side of the knee, which is the most common partial knee replacement. After counseling him and with his consent, we replaced both his knees with the Oxford partial knee replacement. In this, we make a small incision, we don't cut the muscle, and we only replace the inside worn out bit of the knee. We do not touch the other part of the knee, including the ligaments, the cruciates, and the meniscus on the outside. Post surgery, he recovered extremely quickly, started walking almost within a few hours, and went home quickly.
Hello everybody, my name is Prakash Kandawala. I had a severe pain on both my legs, left and right, knee pain, and once upon a time I could not walk properly or stand properly, balance was not there. I consulted Dr. Aditya Kapoor in Omega Hospital, Orthopedic Department, and he suggested me to have a partial knee surgery. Initially he said that we'll open and find out whether partial knee surgery will go or not. Then he did a partial knee surgery and it was a very successful surgery. I am 78 years old, but I feel younger, much younger than what my age is, because I got tremendous improvement on my both the legs, especially pain is fairly gone and my mobility has increased excellently. Once again, I thank Omega Hospital staff and Dr. Aditya Kapoor for doing such a great job on me.
The Oxford partial knee replacement promotes an early recovery and it has lesser serious complications than having a total knee replacement. If you are suitable, it's a superb operation that promotes early recovery with minimal discomfort and a return to a more active lifestyle. Think of it this way, in a car there are 4 tires. If one is gone, would you want to replace all 4? It's pretty much the same with a partial knee replacement, where you replace a single part. Like replacing one single tire is quick and easy, replacing one part of the knee is quick and easy.